Dr. Hakanson. What we'd like to do is talk about your story from beginning to entering into medicine and then your career in medicine.
Okay.
So
I don't know how far back you want to go with my mother and father, but they were both born in Sweden. Somehow, my father inveigled her to come out to Rapid City, 1905, and get married. My dad did not give up his citizenship, so I was born in Sweden and two of my brothers as American citizens. They ended up in some friends in St. Paul, and eventually in South St. Paul, of all places. My dad finally had to take a job as janitor of a school, which is very fortunate because he had a steady salary. It wasn't very much, all during the Depression. After I got to be 16 even, 17, I worked in the slaughterhouses in the summertime, which was very difficult, dangerous, horrible work. I was working for 50 cents an hour or more sometimes. So that's how I paid for my education. I graduated from medical school when I was 23. And then we all knew we were going into the war, and that made a big impression on a lot of us. But I want to emphasize something. At that time, the University of Minnesota Medical School is considered one of the top 4 or 5 medical schools in the country. We had basic science people. I can name them all of them now. Downey, Handbook of Medicine, 3 big volumes. Vischer, who did early work with Einthoven in the electrocardiogram physiology. Bell in pathology, wrote the textbook, and so on. In clinical medicine, we had C.J. Watson in medicine, Wangenstein in surgery, Peyton in neurosurgery, A.B. Baker in neurology, Leo Rigner. They sent him to Stockholm to learn finest radiology at that time. But the point is that these giants, they made rounds with us, you know? They were approachable, and they were fantastic role models. And that's why I ended up in teaching, actually, and a lot of my classmates as well. I learned a lot from my teachers, and I tried to carry out some of the things that they did. I mean, they were dedicated to teaching, research, and community efforts, and so on. I ended up with the USS Ormsby, a troop carrier. The war was still going on. The war in Europe was done, but there were still a lot of problems in the Pacific. We were in the Philippines, and on August 5th, they dropped the atomic bomb. We made it to Guam, but just barely. And from Guam, I was in China with the Marine Corps, and there I spent 17 months with the Marine Corps. So then I came home here, and I decided to get a master's degree in physiological chemistry. And I got that in 1948. And then I got a postdoc scholarship from the U.S. Public Health Service, which later became HEW. I forget what it's called now. But anyway, to study at the Karolinska Institute, specifically the Nobel Medical Institute under Dr. Kasperson and Cell Research and Hugo Theorel, who later got a Nobel Prize, by the way. So I was there for 18 months. And then I came back. Well, that's where I met Karen, and way up north in the ski resort.
Your wife?
And then we came back in June of 1950 and managed to get a small apartment on campus, which was no easy matter. And I started my residency, a fellowship in OBGYN. But I think it was, I don't remember the exact date, but I got a nice little letter from the U.S. Navy saying please report to U.S. Naval Hospital, Oakland, California. There I was in Oakland, regular Naval Hospital. They had 300 deliveries a month and lots of GYN surgery. They had a residency program. So I stayed there, and I revamped the whole program, top to bottom. So it was an interesting experience, and I learned a lot from that myself. And so then I came back here. I was spending more time at Anchor than I was with my private patients. So I went full-time academic, 1963 or 64. Was able to get a grant of $300,000, and that was one big lump of money to give specialist care to high-risk patients in St. Paul. I also started a midwife program, and eventually we had, I think it was about 6 midwives, and got a permission to have a accredited program and a residency program. My problem was, of course, getting adequate staff, and it's not easy inducing people to come to Minnesota because of our bad reputation of being so cold. Well, I got a grant of $300,000 to get professional care for all high-risk patients in St. Paul, and it didn't take us long to figure out that to include unmarried girls. And then we discovered that teenagers were the girls, women, were the most underserved and unhealthy group of the whole bunch. And I said, I think these clinics will help to make these young girls' lives more meaningful in every way. But it was a huge success.
So the girls got prenatal care during study hall while they were still
Yes, we
in
kept
school.
them in school. See, that was a big thing that we hammered in. We were not going to let them lose their education. And then we also, in the early days, had enough money for child care within the school. And I like to think that those programs were at least partly the cause for our declining so-called illegitimate pregnancy rate. It's hard to tell you the culture, the atmosphere in those days about abortion and even birth control. And half of our population are women, at least half, and they're voters. So how can we possibly avoid discussing these issues? It was just a, what shall I say, a question of pushing the agenda so that people should speak out. More women began to speak out and so on. So, and then of course Roe v. Wade happened. I don't know how successful I was actually. All I know is that a lot of our residents turned out to be pretty good. Who was the thing? I think St. Thomas says that teaching was the greatest charity. And so in that case, I think people who come back to me and say, yes, we appreciated what you've done here, or we appreciate this, that was my payment, I don't believe in much, Lisa, but I do believe in change. The same challenges face the women today. It's not won by a long shot. Women still need to fight for autonomy, for agency, and for equality. Those 3 things are absolutely essential. I think there will someday be equality, but it's going to take time. What I emphasize is that over a period of things, times change. The times change very rapidly, and we mustn't be discouraged. We got to stick with our beliefs. A good doctor takes care of the disease, cancer or whatever. But a great doctor takes care of the patient with the disease.